So hi guys, let's talk about schistosomiasis. So this is infection with blood flukes of the genus Schistostoma, which may cause chronic disease in the intestines, liver, and genitourinary tract. So adult flukes are white worms-like creatures that inhibit parts of the human venous system, and all need Miloscan intermediate host. So important species of Schistosomia in Kenya are Schistosomiasis hematobium and Schistosomiasis manthoni. So adult worms live and copulate with the veins of the mesentery. So the sexually mature ones are found in the intestinal veins of the Schistosomiasis manthoni mainly, while for those of Schistosomiasis hematobium are mainly located in the venous plaques of the genitourinary tract. So some eggs penetrate the intestinal or bladder mucosa and are passed in feces or urine. So these eggs hatch in fresh water, liberating cicarii that multiply in snails, which the snail is the intermediate host and produce thousands of cicarii. So this penetrate human skin with a few minutes after exposure and transform the cells into cystostomes, which develop into sexually active adult worms in the intestinal veins or venous plaques of the genitourinary tract, depending on the species. So the lifespan of an adult worm ranges from 3 to 37 years. So Schistosomiasis hematobium is common along the coastline regions of Kenya, Tana River, Kwale, Lamu, South Mansoni is widespread, partially in Machakos, rice schemes, parts of Nyanza, and even in Nairobi. So the clinical features include acute dermatitis and fever after exposure is a rare presentation of the condition. So occasionally transverse myelitis and convulsions may occur. So chronic schistosomiasis with schistosomiasis mansoni may result in partial hypertension, splenomegaly, anemia, and esophageal varices, while terminal hematuria, dysuria, progression to obstructive uropathy, and bladder cancer may occur in cases of schistosomiasis hematobium. So, for metastatic eggs can be found in other organs such as the spinal cord and the brain. So, salmonella infections in patients with schistosomiasis is difficult to eradicate until the schistosomiasis has been treated completely. So, salmonella infections may present as a recurrent pyrexia. Treatment consists basically of pyrimethamine and sulfadiazine combination. So pyrimethamine 200 milligrams in two divided doses, day one, then 25 to 100 milligrams daily for 1 to 2 weeks. So, and then sulfadiazine 75 milligrams per kg on day one, 4 milligrams maximum, then 100 micrograms per kg per day up to 6 grams. So in two divided doses per day for 1 to 2 weeks. So folic acid supplementation is given with pyrimethamine. So clindamycin alone can be given or with a combination of pyrimethamine and sulfadiazine. So for the investigations for Salmonella manzoni, Schistosomiasis manthoni, we basically do stools for over and use concentration for Cato technique. We also do rectal snip for histological examination. We do a barium swallow and endoscopy to demonstrate esophageal varices. We also do abdominal ultrasound. So for schistosomiasis hematobium, we do urine for red blood cells and for ova of schistosomiasis hematobium. We also do a hatching test. We do an X-ray of the lower abdomen, which may show classified bladder, that is sandy patches on the image. Also do intravenous urogram when obstructive uropathy is suspected. How do we manage this? We manage this by giving praziquantel 40 milligrams per kg BD for a day is effective against all types of schistosomiasis. So point to note, patients should be examined for living eggs. If positive, we retreat as of the plan we've talked about earlier on. So for prevention, we prevent this by giving pyrimethamine and sulfadiazine combination. That is pyrimethamine 200 milligrams in two divided doses, as we have talked on earlier on day one. Then 25 to 100 milligrams daily for 1 to 2 weeks. And sulfadiazine, we give 75 milligrams per kg on day one, 4 grams maximum. Then 100 milligrams per kg per day up to 6 grams. So in two divided doses per day for 1 to 2 weeks. Folic acid supplementation to be given with the pyrimethamine and clindamycin can be given alone or with a combination of pyrimethamine and sulfadiazine. Thank you. I bet you can be able to manage the condition way better.